Hi, my name is Josie Martin, and I am a nurse. I work for West Calcasieu Cameron Home Health Agency. I'm a field nurse, so I go out and I see patients every day, doing wound care, educating on medications, disease processes, things like that. Watching the HIPAA protection, avoiding HIPAA violations video, the one area that I think would be the most applicable to my situation would be proper storage and disposal of records. Because we operate out of our own personal vehicles, we have a lot of risk associated with a HIPAA violation because we carry patient information with us in our vehicles. We've got like a little folder that has patient information in it. So it's really important when we're seeing patients, like when we leave our vehicle, if we stop at the grocery store, we're getting fuel, or if we're at a patient's house, our folders have to be contained so that somebody can't look through the window and read the information for patient charts and face sheets and things like that. The other thing is when we're in a different patient's home, making sure that we don't have information for other patients open on our computer or bringing it into the home with them. Making that information available, if someone could look in my window, read the face sheet, makes it so that would be a HIPAA violation. They would be able to know basically patient name, social security number, Medicare information, diagnoses, and depending on what is out there and available for them to see, get a lot of medical information also. So primarily, the number one reason it's important to prevent a HIPAA violation is for our patient privacy, obviously. We want to make sure that their trust in us is high by making sure their information is private, so the general public isn't knowing about every little condition and medication and the things that they're going through. That's all private, and is important for that nurse and patient relationship to keep that information private and secure. The second and maybe more obvious is the financial aspect. We know that for an accidental breach in HIPAA can be like $100 fine for a nurse. And then they increase depending on the severity and the level of neglect, and nurses or healthcare workers can be fined up to, $250,000, $1 million a year, depending on the severity, and even imprisoned if it gets to a criminal level. So anyways, with home health, it's a little bit different because we are not all in one office, so it's a lot more likely for that information to get spread out and shared, I guess, because we aren't keeping it in one location. So that's my input on this topic.